Hello, everyone. Welcome to Indulge Podcast. I'm your host, Sangeeta. Today, we sit down with a mind shaping modern medicine. We dive deep into one of the most complex and often misunderstood areas of healthcare, pain medicine. And our guest today is Dr. Chetana Chetan, Clinical Head Epione Pain Management Center, Chennai, which has made it to the book of records for treating the maximum number of patients with knee pain without surgery using plasma therapy. Dr. Chetana Chetan is also a pain specialist and a diplomat at the American Board of Regenerative Medicine. Let's explore the science behind the pain and let's change the way we think about pain after this conversation. Hello, doctor. Welcome to Indulge Podcast. First of all, congratulations. Epione Pain Management Center has completed 3 years in Chennai. So, could you tell us what pain medicine is?
Pain medicine is like any other specialty in medical field, like cardiology, dental,
Okay.
then neurology, gynecology. Like you have specific specialties. The same way, pain medicine is also a specialty where we treat all sort of pains, like any chronic pain, any pain which is more than 3 months. It can be knee pain, back pain, shoulder pain, nerve related pain, cancer pains, any pain which is lasting for more than 3 months. We treat such kind of pains without doing any surgery with just
Okay.
simple needle injection based techniques. So we treat all sort of these pains without any surgery. We use variety of treatments like we have radio frequency ablation, platelet rich plasma therapy, trigger point injections, prolotherapy, steroid injections, MIPSIs, like variety of treatments. We treat all sort of pains targeting the root cause of pain through these kind of treatments which are safe.
Okay. So, what inspired you to take up pain medicine? Because this is a field that which is not very well known in the country yet. So, what inspired you?
Two things. One is my own personal experience. Like at 35, I had slipped from a staircase and I had sustained ligament injuries in my both the knees.
Okay.
So I was advised for bed rest, and then they said that they're going to wait and then take a call whether to go for a surgery or not. So me as a doctor, I was like wondering, what if I'm asked to go for a surgery?
Okay.
How is the success rate? How much of pain I'm going to have? And what if it doesn't work out on me? Who will take care of my kids? Who will take care of my work? How many days of leave I need to take?
Right.
So all these things, and that 2 weeks of bed rest, I was dependent on my family for every silly, simple thing. So that amount of helplessness, the frustration of being dependent, I felt like I was leading a life of 65 at 35.
Okay.
So that is like, as a doctor, if I have so many queries and worries, what an ordinary man can have. So that's where my journey of digging into pain started.
Okay.
Second is, apart from my personal experience, my professional also took over. With
Okay.
profession, as I started seeing so many patients, there are certain patients' stories, certain patient lines which made me think more into depth about pain. Like a
Okay.
patient who said he has not slept weeks together just because of pain. And there
Okay.
are mothers who are like finding it difficult to wear a blouse, combing their hair because they're having frozen shoulder. And I had treated one elderly man who had trigeminal neuralgia, who had difficulty in talking, chewing.
Oh, okay.
They generally have the shock like of pain. He used to tell me every day brushing my teeth was like I am undergoing a big electric shock kind of
Oh.
treatment.
Okay, that bad.
Yeah. And a 40-year-old lady whom we had treated, she was diabetic. She had severe burning sensation in the legs, which couldn't be controlled. For that, no surgery is there, only the medication. Sometimes medications also don't work. She used to come and tell us, my feet is always on fire, but nobody can see where the flames are.
Flames are. Yeah.
So their sufferings were all invisible. That's when I decided the pain has a lot to be addressed. I got trained, I read, I traveled even to different places to learn from the best. So that's where I am here today.
Okay. So, can you take us through your medical journey also, that how it shaped your career?
I have done my MBBS and MD anesthesia.
Okay.
And like any other anesthetist, even like I did a freelancing, witnessing so many surgeries, giving anesthesia, and also dealing with pain with real time.
Okay.
Also, as an ICU doctor, I have saved so many lives. So I have added numbers to their life, a quantity to their life.
Okay.
When I look back and during my post graduation itself, I felt that the pain was dealt either with painkillers. If it doesn't work, then surgery was the only solution, or you manage the pain. This was what was understood then. So is there anything which we can do in this? When I thought, I took a special training about pain medicine, learning interventional pain management. Then I did my fellowship. Then I became a regenerative medicine specialist, and now I'm a diplomat in American Board of Regenerative Medicine.
Okay.
So learning pain was from my patients. So if you ask me, what shaped me today in my career is not these degrees, but the patient. The
And your
lessons,
own experience.
yes,
Yeah.
the lessons what the patient taught me, which never, which the textbooks couldn't teach me.
Correct, yeah. Nothing like a real life experience
Yeah.
anyway. Yeah. So how does Epione Pain Management Center distinguish itself from other clinics that deal with pain?
At Epione, we see pain as a wholesome thing, not just symptom. Whenever the patient comes to us with pain, we first listen to their symptoms and try to identify where exactly the pain is coming from. For
Okay.
example, if it is a knee pain, whether it is in the problem is in the ligament, whether the problem is in the muscle, or whether the problem is in the bones, or as such in the joint. So we try to make out a probable cause of where the pain is coming from. We do a set of clinical tests done by our pain medicine doctors at Epione.
Okay.
Following this, we come to a probable diagnosis saying that this could be the reason for their pain. And then we do a diagnostic musculoskeletal scan,
Okay.
where we assess the joint as a whole, identify which structure is damaged, whether it is the fluid is, whether the fluid is being collected in the joint, or whether there is a cartilage damage, or whether there is a muscle or a tendon issue. So we try to do a diagnostic scan, and through that, once we identify the problem, we plan a treatment accordingly, customizing to every patient's needs.
Okay.
So suppose a patient is a homemaker. So we keep that in mind and we plan a treatment, and we also put them on a customized rehab exercises.
Okay.
Say somebody is a office goer, so we also deal with them like what are the ergonomic adaptations, how are they supposed to sit in the office, what should be the chair height, how they need to keep their computers or laptops at what level so that the pain doesn't worsen.
Right.
So it is customized rehab is given as per from patient to patient basis.
And what is regenerative medicine? How is it preferable to conventional treatments like surgery?
Regenerative medicine is a new specialty where it is catching a lot of light here. And every body has a regenerative capability. So we are using the same concept to heal or to repair the damage.
Okay.
For example, like a ligament injury. The ligament cannot heal on itself. So we use a patient's own blood, take out only the healing proteins and try to repair the ligament. In turn, try to bring down their pain.
Okay.
So regenerative medicine, it involves using patient's own body's tissues. It can be blood, it can be bone marrow, or it can be even fat. What is Epione's USP is we use more of platelet-rich plasma therapy, that is, which is prepared from the patient's own blood.
Okay, so I was coming to that next. So the Epione is known for PRP therapy, right? So how does this treatment work? Could you give us a picture into it?
Platelet-rich plasma therapy is a simple needle-based treatment where we take the patient's blood just like how do they take a sample for a blood test. The same way we are going to take, say, around 20 to 30 ml of blood, run it in a special machine, extract out only the platelet-rich plasma, which is rich in healing proteins.
Okay.
So we take this and we do a diagnostic scan to identify where exactly the pain generator is, where exactly the root cause of pain is.
Okay.
So using special machines like ultrasound or fluoroscopy machine, using under these image guidance, we deliver this healing proteins with the help of simple needle, without doing any surgery, without giving any general anesthesia or spinal anesthesia, done purely under local anesthesia.
Okay.
So this, when you see this healing proteins, these are natural substances which are already existing in the body. We are just taking it out and putting into the place where it is needed.
Okay.
So we are not using blood from somebody else's body's blood. It is a patient's own blood. Neither are we using any chemicals or medicines from outside to mix with the blood and prepare the plasma. It's purely patient's own blood, which is taken from the patient and put back into the patient body. So it's a kind of natural treatment. When I say natural, it is free of side effects, free of risk involved in it.
And easier also.
Yeah, and healing also occurs naturally. That's the beauty of this treatment.
Okay. So what kind of conditions or injuries do you mostly treat, using this therapy?
More commonly of all the pains is the knee pain. Which comes with the age, that is osteoarthritis, and second, sports-related injuries where you have ligament injuries, tissue injuries, muscle injury, tendon injuries. Such kind of pains can also be treated with plasma.
Okay.
Shoulder pain, like for example, a patient who's a diabetic or the patient is having any thyroid issue. They're finding it difficult to wear their shirt or blouse. They're not able to lift their arm fully to take out the stuff from the top shelf,
Hmm.
or they're not able to comb their hair. They find difficulty even in having a
Oh,
bath.
okay. Okay.
So such cases like frozen shoulder or the muscle tears or even the ligament tears, those can be treated with plasma therapy. After this, there are back pain issues like sciatica, slip disc, or disc prolapse. All such patients we treat with plasma therapy. Neck pains. Many patients who sit in the IT sectors,
Yes.
working constantly over
Yeah.
for like 6 to 8 hours, and then constant mobile users. So those patients who have they're generally with now the trend is like initially what the pain was to be in the old age, it is now shifted to the younger age because of
Correct.
these things.
Yeah.
So they are coming with cervical spondylosis, that is the neck neck spine issues. So those pains are also treated with plasma therapy. The muscle triggers, suddenly the muscle goes into spasm and you take an MRI and see MRI is absolutely normal, yet you are not able to find where exactly the pain is.
Right.
So such kind of things, myofascial triggers, we treat with plasma therapy. Beyond this, the nerve-related pains, the cancer-related pains, the plantar fasciitis, the foot pain. They say generally when they get up in the morning, they find it very difficult to keep the few steps.
Okay.
So
Okay.
such kind of pains we treat with plasma therapy. Beyond this, we treat almost like apart from plasma therapy, we have variety of treatments. As I said,
Okay.
radio frequency ablation, prolotherapy, myofascial trigger injections, Botox injections. So there are a variety of treatments based on patient's pain condition. We take a call on what sort of treatment the patient is eligible for.
Okay. So can all kind of patients opt for this therapy, or are there any restrictions? Like for instance, a BP patient or a patient with high blood pressure.
The specialty of Epione Pain Management Center, if you see here, we treat all sort of pains without any surgery. So we don't do any surgeries in our center. It is purely a non-surgical center where we treat with only through injections. So when you say when it is not having surgery, it doesn't require anesthesia also. So
Right.
generally conditions like BP, sugar, heart issues, kidney issues, they are a problem for surgery because sometimes they're
Correct,
not
yeah.
fit for surgery, or
Yes.
they can have life-threatening problems during the surgery. Since this treatment doesn't involve any surgery, any anesthesia, it is safe. It can be taken by anyone, whether they have BP, sugar, cardiac issues, or kidney issues, anyone of any age group.
Okay.
Not necessarily the young generation or the sports people have to take it, right from 18 years up to 90, 95 or beyond.
Oh, okay.
They can take
Interesting.
this treatment.
Okay. So does it require hospital admission as well?
Definitely no, because again, as I said, this is a non-surgical treatment.
Right.
You can finish just drawing the blood, preparing the plasma, and putting back into their joints. It just takes 2 hours. So you can finish the treatment in a couple of hours and get discharged. No need for hospitalization. No need for any bed rest. You can resume back your activities very next day.
Oh, that's interesting. So what are the typical results and the recovery timeline for patients who undergo this therapy?
Plasma therapy is a kind of natural treatment. So when I
Okay.
say it's a natural treatment, you need to give some time for the nature to work.
Right.
You need to give some time for the nature to heal. So it is, though it is initially slow, but gradually your pain comes down. Gradually your healing takes over and you can resume back your activities. It won't be that painful and all.
Okay. Oh, okay. So are there any inspiring patient recovery stories that you can share with us?
Yeah, there are many, but the recent one which reminds me when I'm having a conversation with you is a 60-year-old lady who was a teacher. She used to shuffle from from floor to floor, taking classes, teaching teaching with standing for a long time. Now today she is not able to walk around within her own house. She barely goes out from her house. When she came to us, she was in severe pain. She said that she has tried all sort of treatments like physiotherapy, the alternative medicine. She even consulted for a surgery also. But her only one thing was, I don't want to go for surgery. I am ready to live in pain, but not for surgery. That was the thing what she said. Then she said, we asked her, what is your expectation from us? Having gone through so much, you would have come with some expectation. All I want is, she said is, all I want is, I need to walk to the puja room without any help.
Okay. Okay.
So we thoroughly investigated her. We took her symptoms. We did all the examination. We did the diagnostic scan. Then we treated her with radio frequency ablation with plasma therapy with the 2 or 3 sessions. And slowly she started improving. 1 month later, when she came for a review, she came with the homemade sweets in her hand.
Oh, nice. Okay.
And she said, I want to offer this to my God. That was something which left me in tears.
Quite a moment, yeah.
So that reminded me that pain is something which adds or affects the quality of life.
True, true. Yeah. So today you were talking that more younger people are, prone to pain as well because they're constantly using phones and all that. So how do you think, people can improve their lifestyle when it comes to, avoiding pain?
Individual's body is their own responsibility.
Hmm.
If you don't take care of your body, you cannot blame others for not taking care of you.
Correct.
Very
Yeah.
simple.
Hmm.
So till 40, if you see, your body will listen to whatever the stress you give it to the body.
Hmm.
But after 40, body will dictate what you have to do, what you cannot do.
Cannot do. Hmm.
So that first 40 years, if you ignore, like you said, the work from home era, people sitting with the phones, laptops for quite a long time. They are sitting in a bad posture. They slouch and sit for hours together, skipping their meals, skipping, not even drinking water. So
Correct,
sitting with such a long time with a bad posture, ignoring their diet, ignoring their sleep, is something which is really bothersome. So all this is attributing to the pain. If you see the young generation, the sports is again more. Playing sports is a good thing, but ignoring the sports related injuries is a bad thing.
Right.
Now the trend, which was like initially, if you see, the pain was initially in the old age. Now the trend is changed.
Correct.
Now
Yeah. Younger people are
walking
to
with
pain.
old knees.
Oh, okay. Right.
I had two patients yesterday where the first patient was in the morning who was 80 years. If you see her joint, it's like a 20 or 30-year-old joint, knee joint.
Okay.
The same evening, I saw a 40-year-old lady who walked into my clinic for knee pain, and if you see her X-ray, her joint is like 80-year joint.
Okay. Okay.
See the trend where once upon a time this pain was meant only for the old age. Now it
people.
is coming to 30, 40 years. Here the difficult thing here is what treatments you give at 60, 70 years is not the same knee with the same amount of damage. You cannot give the same treatment of 30, 40 years.
Correct. Yeah.
So 30, 40 years, what you're left is to live in pain because you're going to try physiotherapy, which is not going to be helpful to a long term. Then you will try all the kind of things. You want to walk, you want to jog, you want to do yoga because the pain has started. It's then you realize that you have to do all these things.
All these things, yeah.
But your body is not cooperating because you're having pain. So I always suggest people, when the problem is small, don't ignore it.
Right.
Reach to a right doctor. Take a right treatment on right time. Earlier the treatment, better the results are. You can avoid surgery or even you can delay the surgery in future.
Right.
So the knee pain is quite common among youngsters now. Beyond this, if you see, using laptops, mobiles, and bad posture are attributing to the neck pain, back pain, which is quite common. The good news is, if you do your lifestyle modifications on time, these can be avoided.
Right.
Okay, so I say whenever the patient is having any pain, especially youngsters, don't assume that you are young, your body will tolerate everything. It will tolerate to one extent, and beyond which you have to surrender to your body.
Right. So what do people like those in IT sectors who spend a lot of time in front of computers, what should they do? Can they get up and, I mean, some tips you can give to them, who are constantly seated in front of a computer?
Yeah, I generally suggest IT people who sit for so long, 6 to 8 hours at a go, sometimes even 10 hours, is that wherever you are sitting area should be proper according to what your body structure is. Like for example, you're sitting in the front of computer working for 6 to 8 hours, your chair height should be proper.
Right.
The chair on which you are sitting should be good, which has good back support, the arm support to keep your hands and work comfortably. Second, the distance where you keep this computer should be at least 1 arm distance so that you don't strain your eyes. Then you will start slouching like this, which again affects your neck.
Correct. Yeah.
So this is what is called as ergonomic adaptations. That is the adaptations at the workplace to avoid pain. Second is, yes, as you rightly said, constantly sitting for too long is also not good.
Sitting is the new smoking.
Yeah. So you need to avoid the smoking effect is by taking breaks in between, like going to the next cabin, getting a file, or taking a water break, taking a toilet break, restroom break, or taking a coffee break in between. Make sure you get up once in half an hour or 1 hour. Take a small walk, or you compel your body to do some activities so that there is a change in the posture, and this can reduce the pain.
So, doctor, could you tell us what are the common misconceptions about pain medicine? Something that you often hear.
Many patients, they first ring over phone and say, you're a painkiller doctor, right?
Painkiller doctor. Okay.
Okay, you give us some medicines or some oils or some packets I don't know what powder packets goes out
Okay.
for pain. I was like, no, this is an allopathic center. We don't treat we don't treat pains with such kind of medicines. When they walk in, they assume that I'm going to prescribe them some magic pills to get away with the pain. If it had to be treated with only with the pills, I would have not been there today.
Correct. Yeah.
So your pain is not just treating with the painkillers. We need to address the pain at the root cause. So that is the one myth first they come across. Second, when I suggest them that you need injections, I'm okay with everything, doctor, but I don't want needles.
Okay.
When I said needles, nobody would like to go undergo needle.
Correct. Yeah.
Yeah. And they assume that when I say injection, they assume that like any other fever or pain injection, they give it either in the hand or in the buttock. The same way they think that those injections are there. No, we give injections targeted. Wherever is your pain, wherever is your damage, we give the injections right in the target place.
Okay.
So very accurate because we use special machines, try to identify the damage and exactly where the damage is. We reach there and deliver the medicine. So very accurate. In this way, if you see the chances of success is very high. So this is not those injections which you think about like while you have any fever or any other pain you get either in your muscles. Okay. So the third thing is that when I say, doctor, now the pain is not relieved with painkillers, surgery is the only thing, only solution next. This is a big myth which I think I encounter every day, this one.
Okay.
So surgery is not the only solution. Surgery is one of the options for the treatment of pain, but it is not the only solution. There are now many advanced treatments without surgery where you can tackle your pain. Many smarter options are available.
Right.
So these three things I feel, yes, public needs a lot of awareness where I'm ending up like giving more of awareness, and even my social media pages also has a lot of information about this. So this is something which is very commonly encountered misconception I come across every day.
Okay. So earlier you shared some tips about how to, help yourself when you're working for so long sitting. So could you give us some long-term tips also for a long-term health? What should an average person do to avoid pain?
I always say pain will always affect your smile.
Okay.
So you maintain your own smile by following a smile. That smile is sleep. So you need to have at least 6 to 8 hours of sleep because sleep is a reset button in your body.
Right.
It needs a pause. Because during sleep there are certain hormones are released which brings down your stress and makes your body ready for the next day's stress.
Correct. Yeah.
So first is S is sleep. Second is meditate. Try to listen what your body is trying to tell you. If you fail to listen, then you will end up going to a doctor just to make it listen. So meditate. Second is meditate. Third, if required, continue with some medications if it requires, based on your cause of pain.
Right.
I is ideal body weight. So maintain a body weight which is described as per your height.
Right.
So maintain your ideal body weight. L is, I said, lifestyle modifications, which is very, very important, which is simple, doable. All we need is we need to put an effort to follow the healthy lifestyle.
Right.
Like doing an exercise, going for a walk, maintain a regular routine of going for a walk, having a good healthy diet, drinking adequate amount of water, having a small amount of sun exposure. All this is lifestyle modification. The last is E, exercise. Spend at least 15 to 20 minutes regularly on doing exercise. So if you follow this smile, I think your smile, you can retain it. Don't allow the pain to boss your smile.
Yeah, I think that's a very nice concept, smile. And what is one non-negotiable self-care habit that you believe everyone should follow?
Sleep.
Sleep. Okay.
6 to 8 hours of sleep is a must.
Okay.
No matter how binge series you watch on Netflix or you stick on to Instagram, please don't compromise with your sleep.
Right.
6 to 8 hours of sleep is a reset button which you can do it for your body.
Right. Finally, what is your vision for pain medicine in India?
Generally, when it comes to the pain clinic, the patients are like, they've almost done the shopping of hospitals, doctors, and then they land up last to us because
Google doctors.
Yes. I would like to see pain medicine as a first specialty and not the last stop, because patients who come to us are like considered us as last stop because they would have done a lot of shopping of hospitals, shopping of doctors, going from different specialties, allopathy, Ayurveda, say the different alternative medicine specialties, and then they land up to us. So I want people to consider pain medicine as first specialty and not the last stop.
Okay.
So I want more people to say, let me go to a pain specialist, find out what is a non-surgical option I have before considering the surgical thing.
Okay. Okay.
So I want more of awareness, more of education, where pain is, or sorry, where treatment is not just clinical but as human.
Okay. Okay. Quite interesting. I think that was quite an interesting session. Thank you so much, doctor, for your time. Thank you so much.